Hi, hello. So for our today's discussion, we'll be talking about neuropsychological assessment. So for our chapter 14, it will be divided into two parts. So part 1, I will be discussing it to you, and for part 2 naman, we will be having Jezreel Jose for its discussion. So Chapter 14, Neuropsychological Assessment. Let's proceed. First things first, i-discuss dato balik kung unsa ang neurology, ang neuro, and everything else, its aspects, no? So, ang neurology, it is a branch of medicine that focuses on the nervous system and its disorders. So, of course, kung isa siya ka branch of medicine, it is a study. It is a study about the whole nervous system and what comes along with it. So, mao na siyang mga disorders. So, of course, kung ang nagka-concern siya sa disorder, of course, the neurology is also concerned with the treatment of the disorders of the nervous system. So, again, for sure, kabalo na ta nga ang nervous system. It is a very complex, it is very sophisticated system na nag-regulate sa tuang body activities. Mo ang coordinate sa tuang body activities, sa tuang behaviors, sa tuang lihok, sa tuang movement, sa tuang stiffness, tuang rigidity. Mo na siya ang nervous system ang bahala ana. That is why there is neurology, because as mentioned ganina, it is concerned with or it focuses on the nervous system itself and what comes along with it. So if there is neurology, of course, there is also neuropsychology. So, neuropsychology is the branch of psychology that focuses on the relationship between brain functioning and behavior. So, ang relationship ni brain and ang iyahang influence ato ang behavior. So, mao na siya si neuropsychology. So, ang mga professionals sa neuropsychology, they study the nervous system as it relates to behavior by using various procedures, including neuropsychological assessment. So, ginagamit ang neuropsychological assessment so that ma-measure nato ang or mahimo siyang procedure for neuropsychology. So, unsa ba si neuropsychological assessment? So, it is defined as the evaluation of brain and nervous system functioning as it relates to behavior. So, si brain itself, since again, si neurology is about ang neuropsychology is about the brain functioning and the behavior, ang relationship between sa duha. So, the neuropsychological assessment does its jobs in evaluating how brain and nervous system functioning relate sa behavior sa isa ka individual. So, mao na siya ang neuropsychological assessment. So, of course, no, si nervous system and si behavior na ay relationship, of course. Now, before ta mag-talk about its relationship and everything else, let's talk about how or what composes the nervous system. But worry not, because I have attached here a video, a very short clip lang, kung asa ma-explain nato si nervous system. So, kindly watch the video, and then we will continue for the discussion of the nervous system and behavior.
Today, we will talk about an organ that rules all of our body, and that is our brain. As it is the most sensitive organ, our brain is kept inside a bony covering called skull. From doing physical activity to solving logical problems, from dealing with emotions and feeling to creativity, the brain is responsible for all. Therefore, it never sleeps. Our brain can be divided into three main parts: the cerebrum, the cerebellum, and brainstem. Cerebrum is the largest part of brain, which can be further divided into right and left halves, called hemisphere. Each cerebral hemisphere has 4 lobes, namely frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Each lobe performs different functions. Cerebellum is responsible for movement and coordination. It gives you sense of balance and thus prevents you from falling down. Brainstem includes midbrain, pons, and medulla oblongata. It controls your body's involuntary actions, like breathing, heart rate, and blood pressure. Brain comes under a system called nervous system. Structurally, nervous system is classified into two types: central nervous system, CNS, and peripheral nervous system, PNS. The central nervous system comprises of the brain and spinal cord. The spinal cord is the bridge that connects the brain to peripheral nervous system. It starts from medulla oblongata and stretches to lumbar region of the spine or vertebral column. The peripheral nervous system is a network of nerves spread across our body. Think of peripheral nervous system as a network of highway that connects the body with central nervous system. This highway has two-way traffic. Let's see how. When you hold a hot cup of coffee, sensory neurons in your hand transmit signal to brain through sensory neurons, also called afferent neurons, that the cup is hot. Your brain processes that information and send response through motor neurons, known as efferent neurons, that you must put that cup back. PNS consists of total 43 pairs of nerve, among which 12 originate in brain, named as cranial nerves, and 31 originate from spinal cord, hence called as spinal nerves. Here, you hear the word neuron. Neuron is the basic unit of nervous system. It is the nerve cell which transmit electrical signals to brain. A neuron has three parts: dendrites, soma or cell body, and axon. Dendrites serve as input device for neuron because it receives input from other nerve cells. Soma or cell body of neuron contains nucleus. Axons serve as output device from where it transmits electrical response to other neurons. I hope this helps you in understanding nervous system.
Now, let's proceed naman sa neurological damage. So, of course, throughout the years, there has so many studies, researches nga nag-undergo og pila ka procedures just so that we could have results and basis for our assumptions, theories. Because of those researches, we were able to come up with what affects or kung unsa ang kanang mag-manifest sa brain and how does this affect our behavior. So, first and foremost, we have neurological damage. So, si neurological damage, it could take the form of a lesion in the brain or any other site within the central or peripheral nervous system. So, inside sa tuaning nervous system, no, ang neurological damage mag-take place siya within our nervous system. So, ang neurological damage, ma-consider siya or ma-distinguish siya pag naay lesion. So, ang lesion is a pathological alteration of tissue, which are such as that which could result from injury or infection. So, pag naa si lesion, naay alteration of tissue mo nang ilhanan nga naay neurological damage, mag-result siya sa injury or infection sa within our nervous system. So, ang neurological lesion may be physical or chemical in nature. So, pwede siya nga ma-distinguish as a tissue nga makita dyan nimo nga naay alteration, or it could be in terms sa chemical. So, they are characterized as focal or diffuse. So, si focal is relatively circumscribed at one site. Na siya makita sa isa lang ka site. Or, pag diffuse naman siya, pwede siya magkatag-katag, scattered at various sites. So, baliko na ako ha, si neurological damage kay mag-take form siya as a lesion. So, si lesion, unsa gani na siya, it is alteration in tissue. So, pwede siya nga physical, as in makita jud nimo, matouch nimo nga na alteration sa tissue, or it could be chemical in nature. So, sa atong lesion na siya two kinds. si focal, and si diffuse. Si focal, makita nimo siya sa isa lang ka site. Si diffuse, makita nimo siya in various sites. So, nagkatag-katag siya. Mao na si focal and diffuse. And mao na siya ang reason as to why na ay gina-consider nga neurological damage. So, of course, pag naay neurological damage, naay mga behavioral deficits. Pag nasi neurological damage, naay behavioral deficits. So, since naman tay focal and diffuse nga lesions nga mao na siyang gina-consider as reason nga nung naay neurological damage, pag si focal nasa isa ka site, maapektuhan to nga site, and then mag-result siya nga naay deficit sa behavior kung asa naga-function to nga site. So, let's say for example, naapektuhan niya si naapektuhan niya si parietal lobe. So, pag let's say naay lesion sa parietal lobe, naay neurological damage din. Now, ang parietal lobe kay naga-function siya, 'di ba, as katong sa sense of touch, kanang dito ang reception area sa sense of touch and sense of bodily position. So, pagkato siya naapektuhan, of course, ang iyahang function dili mag-work, dili mag-function, naay damage, in which maapektuhan ang reception nato for our sense of touch and our sense of bodily position. Now, there are kanang nakalist diri sa to ang table 14-2 kung unsa tong mga technical names sa mga many varieties of sensory and motor deficits nga result siya sa neurological damage. So, first, we have here, now, since this is this is technical name, so, there are, this could be, kanang lisod siya i-pronounce, lisod siya i-enunciate. So, sorry in advance if I have wronged its term, pero this is based upon my research and my understanding, my knowledge. So, first sa to ang listahan is the acalcula. So, ang description ani nga deficit is that it is the inability to perform arithmetic calculation. So si arithmetic calculations asa ni siya nga site mag-function. Yes, dito sa frontal lobes. So since need man ta nga sa frontal lobe is naga-function man siya as a site nga naga-enable for us to think systematically and think logically. So, pag naatay acalcula ang isa ka individual, na siya problema sa iyang frontal lobe. So, ang lesion na dito sa frontal lobe, na siya neurological damage. And again, ang tawag ato is acalcula, which is inability to perform arithmetic calculations. Next, we have acopia. Acopia is the inability to copy geometric design. So, maglisod ka o identify sa visual information. Asa makita si visual information or para sa asa si visual information? It is either in occipital lobe or sa tuang temporal lobe. So, si temporal lobes is kanang naga-function siya for visual information, for processing visual information. So, kung dili ka makakopy or dili nimo ma-recognize ang shape o ang design sa geometric nga gipakita sa imuha, na kay problema sa imuhang temporal lobes. Now, third, we have agnosia. Agnosia is the deficit in recognizing sensory stimuli. So, mao ni siya ang difficulty in auditory, as long as it's sensory stimuli. Mao na siya si agnosia. We also have agraphia. Agraphia is a deficit in writing ability. Si akinesia, which is deficit in motor movements. Alexia, inability to read. Amnesia, surely kabalo mo ani makita ni madungog ni sa mga drama. So amnesia is loss of memory. Amusia is deficit in ability to produce or appreciate music. So asa si amnesia nga damage, makita ni siya dito sa temporal lobe. Now, we also have anomia. Anomia is a deficit associated with finding words to name things. We have also anopia, which is deficit in sight. Ang damage ani na sa occipital lobe. We also have anosmia, deficit in a sense of smell. Makuha na to ni siya mahibalaan nato ang kani siya nga sight na kani siya nga damage makita sa sight sa frontal lobe. And then we also have asa naman ta. We have anosmia, deficit in sense of smell, aphasia, deficit in communication due to impaired speech or writing ability. We also have apraxia, which is voluntary movement disorder in the absence of paralysis. And last sa tuang listahan sa table 14-2 is ataxia. So si ataxia is deficit in motor ability and muscular coordination. So kaning table 14-2 makita ni siya sa page 491 sa book ni Cohen. So if you have time, kindly read table 14-2 and at least familiarize the technical names for various kinds of sensory and motor deficits nga caused by the neurological damage. Now, we will proceed sa next part sa tuan chapter 14 part 1. Now, we'll proceed to be discussing or to discuss about the neuropsychological evaluation. So, surely we all know what evaluation means, and since this is an evaluation for neuropsychological, it is involved in the nervous system, sa neurological nga part sa toang body, and its influence or relationship sa toang behavior. Now, of course, siguro, surely, or dili siguro tanan, no? But we have experienced kanang magpa-evaluate sa or magpa-assess or examination for our health. So, ang examination ginakonduct ni siya sa mga specialist who is more thorough and quite different in terms of the tools and tools nga ginagamit nila and methods nga ilahang gina-employ. So, if nagpa-assess ka sa imuhang deficiency, of course, another method ang gamiton another tool ang gamiton But of course, lahi-lahi man naman tayo lahi-lahi nga body parts, na tayo lahi-lahi nga kanang system sa tuang lawas. So lahi-lahi pud ang ginagamit nga tools and methods nga gina-employ, no? So ang kaning mga specialists, no matter who or unsa ang ilang specialty, pag naa sila ma-discover nga problem, especially by general practitioner during a routine screening, pag makakita sila or mabantayan nila, ma-observe nila na during silang assessment, makakuan nila nga makadiscover sila og any problem, mag-result jud siya sa referral to a specialist kung asa mao dito ang focus. So for further evaluation, dito nakamuad to. So, kung asa man kag-refer, no? So, kung in general practitioner. Now, kita mga psychology student and mga professionals sa tuang degree is that kanang nag-evaluate pud ta, nag-assess pud ta. So, bisan pa ang mga clinical and counseling psychologists, ang mga school psychologists, or other mental health professionals nga nag-engage in assessment, pag sila nakabantay or naka-observe, nga naka-discover, nga na ay near psychological problem ang isa ka individual nga ilahang gina-assess, they would refer it to a specialist for further evaluation. So, ang this is the reason why ang degree or ang kanang course load sa ato ang degree sa psychology is very wide, since gina-study pud nato ang possibility for neuropsychological damage and what we should do when we have discovered something, no? Now, apil sa tuang gina-assess or apil sa tuang pag-assess ang neuropsychological evaluation. Now, if people of that profession identify a problem that they believe is a neurological in nature, whether through their own examination or kanang nadungog nila from the client themselves, or ma-discover nila through a test, or case history data, i-refer siya sa specialist nga nag-focus of course sa neuropsychological or neuropsychology, and then mag-ensure dara ang neuropsychological evaluation. So si neuropsychological evaluation typically pag katong mga mention nga mga psychologists or katong or other mental health professionals, pag sila ang mag-assess, typically mga non-specialist man sila, no? Mga consider sila nga non-specialist. So, what they're trying to do is screen for the presence of a possible neuropsychological problem rather than definitively diagnose such a problem. So, ato ang job when, of course, makagraduate ta and puhon-puhon maka-attain ta sa tuang degree, ato ang role in terms of neuropsychological evaluation is to evaluate or to discover if there is a presence of a possible neuropsychological problem or damage. With that, again, as gi-mention ako ganina, mag-ensure na dara ang pag-refer sa specialist who is more focused on the neuropsychology. So, mao na siya ang kanang ginabuhat. Mao na siya ang typical nga ginabuhat nato sa tuang degree, sa tuang profession. Now, for the prompting for evaluation, unsa ang kanang mag-prompt for evaluation? Natay ginaingon or natay kuan nga hard sign. So, si hard sign may be defined as an indicator of definite neurological deficit. So, ang si hard sign kay term ni siya nga kanang ginagamit when kapag kanaganing sure ta nga naay neurological deficit. Pag nakuha na to, nabantayan na to sa tuang evaluation, sa tuang assessment nga there is neuropsychological damage or problem, then we can use the term hard sign if we are too sure, we are confident, we are sure jud nga naa jud neurological deficit. So, unsa man yung mga neurological deficit, no? Abnormal reflex performance. Kanang pag naay kanang deficit ana nga kanang test, then there is kanang evaluation or assessment or conclusion ato nga evaluation nga naa joy neurological deficit. And of course, unsa atong term ana hard sign. So, an abnormal reflex performance of our client may prompt for hard sign. Another one is cranial nerve damage as indicated by neuroimaging is another example of a hard sign. So, duha ang ato ang example nga gi-state sa book, ang abnormal reflex performance. So, pag naay ka ng medyo odd sa iyang performance in terms of reflex, there could be or there is surely a possibility for neurological deficit. And pag nanapoy cranial nerve damage, hard sign, meaning surely, definitely nga naay neurological deficit. Now, if of course naatay hard sign, napud jud day soft sign. So, si soft sign is an indicator that is merely suggestive of neurological deficit. So, kani dili pa kaayo ta sure, murag duha pa ta. Probably naay possibility nga naay neurological deficit. Pag naay inanang mahitabo, soft sign. So, si hard sign, sure ta definitely naay neurological deficit. So, meanwhile, si soft sign naman, nagasuggest lang ta or gina-refer na to siya to further investigate if there is really a neurological deficit. So, one example of a soft sign is an apparent inability to accurately copy a stimulus figure when attempting to draw it. So, nganong soft sign lang ni siya nga problema or soft sign lang ni siya nga nganong kani siya nga problema is naga-prompt lang siya for soft sign. Soft sign lang siya is that because there are other possibilities that we might consider. Dili lang siya kaayo, let's say for example, dili lang siya kabalo mo drawing. Wala siya naglisod o identify or process sa information nga yang nakita. Wala siya naglisod o pag-recognize sa shape. Pero dili siya kabalo mo drawing. Mo nang naay kanang naay something wrong sa iyang drawing, no, sa iyang pag-copy. Pero if of course since soft sign lang man siya, gi-refer nato siya to further investigate if this evaluation of ours kanang nakita nato nga problema sa iyaha katong apparent inability to accurately copy a stimulus figure when attempting to draw it, then gi-prompt nato siya for further investigation to ensure that this is this a neurological deficit. So another soft sign nga makonsider nato is ang neurological deficit nga mag-take form of relatively minor sensory or motor deficit. So nasa ato ang slide makita ang very reason as to why i-consider siya nga soft sign because of the word minor. So again, balikon nako ang mag-prompt for referral. Mag-prompt for referral to a specialist nga naga-focus jud sa neuropsychology or neurology is ang hard sign nato ug soft sign nato nga evaluation from our examination, from our case history taking, or sa tuang assessment. So mao na siya ang neuropsychological evaluation. Now, kung mag-prompt ang katong abnormal reflex performance sa isa ka individual, sa isa ka client, nga katong naay makita nga cranial nerve damage nga nakita sa neuroimaging, tapos naapod tong problema sa inability to copy katong stimulus figure pag itry siya og draw, tapos naapoy katong problema for naapoy problema for sensory and motor movements. So kato siya again mag-prompt siya og further evaluation, no? But sa tuang table 14-3 na-indicate dariya ang other conditions that may prompt referral for neuropsychological evaluation. So kani siya aside atong upat ka buok nga naka-state for hard sign and soft sign, natay 1 2 3 4 5 kabuok nga conditions nga gi-state sa book para atuang kanang ma-learn and how this become a reason for referral. So pag ang isa ka client, ang isa ka individual na ay condition or brain injury resulting from stroke, traumatic brain injury, concussion or infection, i-refer nato siya for neuropsychological evaluation. Reason for that is that differential diagnosis of brain injury and disease from psychiatric disorders such as depression. Now, second sa tuang listahan is when a client have a condition of epilepsy, hydrocephaly, or other known neurological conditions. Third, acquired immune deficiency syndrome or ang AIDS, mostly nahibalaan nato siya nga AIDS, no? So i-refer gyapon nato na siya for neuropsychological evaluation. We also have Alzheimer's disease and other forms of dementia, problems with attention and learning. Another one is any significant changes from usual sensory, motor, or cognitive functioning. So, ma-determine nato siya whether the observed deficit is a functional deficit or a deficit that is psychologically or a deficit nga psychological or without a known physical or structural cause. So, magnapoy organic deficit, mao ni siya ang deficit known to have a structural or physical origin, i-refer gihapon nato siya for neuropsychological evaluation. So again, kaning table, kaning conditions that may prompt referral for neuropsychological deficits kay table 14-3 makita sa page 494 sa tuang chapter 14, the neuropsychological neuropsychological nga part sa tuang Cohen nga libro. Now, let's move forward sa next topic na to. So, si general elements of neuropsychological evaluation. So, kung kaganina, kuan lang to siya sa mga non-specialist nga ginabuhat, no? So, katong unsay mag-prompt og evaluation for neuropsychological nga evaluation, kani siya naman is ang elements pag naa nata sa neuropsychological evaluation. So, mao na siya tong after isa ka individual ma-refer sa specialist nga naga-focus sa neuropsychological nga mga problema. And specialist nga mag-conduct sa neuropsychological evaluation. So, ang pag-conduct ani sa evaluation magdepende sa referral question, sa capability sa pasyente, sa availability and nature of records regarding the patient, and the practical consideration. So, kung naay problema sa unsa to nga mga parts nga akong dimensions, of course, there is kanang certain procedure nga buhaton ang neuropsychologist. So, ang neuropsychological evaluation, unsa ang objective niya? So, kaning neuropsychological evaluation, ginabuhat ni siya to draw inferences about the structural and functional characteristics of a person's brain by evaluating an individual's behavior in defined stimulus-response situation. So, nagakonduct og mga test nga mga test nga kanang nagatest sa behavior, no, nagatest or exams or assessment nga nagatest sa individual's behavior para ma-identify kung asa siya na ay problema, and then ma-relate siya kung asa man to siya nga site sa brain sa pasyente. So ang examination sa neuropsychological evaluation mag-start of course sa thorough examination of available relevant records. So, si relevant records mo ni siya ang mga medical records, mga currently nga ginatake, mga supplements nga ginaperminti og inom ni pasyente, ug unsa ang iyang mga sakit currently nga pamati. So, mo na siya ang first nga step sa pagbigin sa examination. Second is that making sure that the appropriate tools of assessment will be employed. So, i-make sure sa neuropsychologist nga ang tools nga gamiton for the assessment kay tama, again, appropriate sa pasyente, sa pasyente nga gi-refer. Now, third sa tuang list or step for the examination, how examination begins is that neuropsychologists will administer preliminary visual, auditory, memory, perceptual, and problem-solving or cognitive processing task. So, kani si mga task mo ni siya ang katong task nga mag-measure or mag-test sa behavior sa individual. So, pag naay mabantayan nga naa siya problema sa visual, of course, i-relate to ni neuropsychologist kung asa nga site ang naka-assign for visual, and nganong naay problema sa behavior in terms of visual. So, ma-conclude niya kung unsa ang mga problema ug asa ang problema. Now, the following slide will show you of how unsaon sa neuropsychologist pag make sure sa or pagbigin sa examination. So, we have history taking, the case history, and case study. So, unsam ni sila? So, kaning tulo is mo ni siya ang mga medical history sa patient. So, again, tanawon tong current, previously nga mga kanang problema in terms of medical sa pasyente. Second, mo po ni siya ang medical history of the patient's immediate family and other relatives. So, kung mag-ensure ka o investigation, i-make sure nimo nga dili lang ka nakalimit sa pasyente, but of course sa immediate family and other relatives sa atuang pasyente, so that makuha nimo ba matugma nimo ang imuhang facts. Third, the presence or absence of certain developmental milestones. So, specifically natin mga milestones nga kinahanglan nga ma-achieve, and then if there is an absence for these, na something odd nga nahitabo, na something strange, mo na siya ang mag-ensue og evaluation. Now, we also ang history taking, case history, and case study, mo po ni siya ang psychosocial history sa pasyente. And lastly, the character, the severity, and progress of any history of complaint. So, kung nasa mga sakit sa kasukasuan, mga inana, history taking na siya nato sa ato ang pasyente. Now, the next slide will show you table 14-4. If I'm not mistaken, this is table 14-4, some developmental milestones. Again, pag absent sa certain developmental milestone sa isa ka individual, pag na siya mga development nga wala na achieve, na absence again, meaning mag-ensure siya og kanang further investigation. So, mao ni siya sa inyong slide, makita ang developmental milestones by age. So, from 16 weeks to 60 months. Tapos, of course, nag-correspond dara ang mga development nga dapat makita nato sa isa ka toddler, sa isa ka individual. Now, sunod sa tuang kanang listahan isang interview. Kung kaganina na history taking, case history, and case studies, we also have the interview. So, the interview is a variety of structured interviews and rating forms which are available as aids to the neuropsychological screening and evaluation process. Of course, mag-ask man jud ta og question para ma-ensure nato kung naa ba siya problema sa speech, sa communication, sa processing sa iyang idea, sa processing sa iyang information nga gina-emit. Now, the interview can help shed light on questions of the organic or functional origin of an observed problem and whether the problem is progressive or kanang progressive meaning worst or non-progressive. So, sa interview, makatabang ang interview in terms sa paghibalo nato kung unsa asa gikan o kanang kung ang problema ba niya in terms atong mga tasks nga gi-perform is very kanang nag-worse na ba siya, kanang progressive na ba siya. Now, another type of examination that a neuropsychologist employ is that the neuropsychological mental status examination. Of course, we were introduced sa MSE, no? Nag-conduct po tag MSE sa toang mga specific partners. So, the neuropsychological mental status examination include questions regarding the assessee's consciousness, emotional state, thought, content, and clarity, memory, sensory perception, performance of action, language, speech, handwriting, and handedness. So, kaning mga parts sa MSE nato, of course, since gi-introduce naman na sa tuwa katong i-ask nato sa iyahang consciousness o unsang date karon, unsay pangalan nimo, asa ka nagpuyo, iyahang practically how he or she kanang deliver his speech, may nana gani. So, mo na siya ang ato ang bantayan o anong ato ang need nga i-observe during the neuropsychological mental status examination. So, also, ang clinician will observe and take note of aspects of the assessee's behavior relevant to neuropsychological functioning. So, aside sa katong structured na nga mga questions nga ipangutana nimo during the MSE, ang MSE, during sa MSE, it would be the chance for the clinician or for the neuropsychologist or for a specialist to conduct the neuropsychological evaluation to observe kung unsa tong mga behavior nga possible or kanang naay connection for neuropsychological functioning. Now, again, natay history taking, case history, case study, napuday interview, napuday neuropsychological MSE or mental status examination, we also have the physical examination. So sa physical examination, mo ni siya ang extent of this, mo ni siya ang physical examination nga perform og non-invasive procedure. So, the extent of this examination varies widely as a function of the expertise, competence, and confidence of the examiner. So, dili ni siya basta-basta pwede ma-employ or magamit or gamiton as a tool or as a method since ang need ni siya og expertise, need ni siya og expert nga mao ang magbuhat ani. So, commonly, ang ginabuhat nga mga perform o ang mga procedure sa physical examination is non-invasive. So, mo ni siya ang mga procedure nga do not need that does not involve any intrusion into the examinee's body. So, dili ka magtusok-tusok drug injection diri sa physical examination. Basically, a physical examination, tanaw lang nimo iyang movements, iyang coordination sa iyang lawas. Basically, sa physical examination lang. There is no need for you to kanang ensure a test or neuroimaging something para basta non-invasive ni siya nga procedure. Again, physical examination. So, sa physical examination, ang buhaton sa examiner ani, pwede siya mag-examine sa scalp and sa skull gani for any unusual enlargements or depression. So, kanang tan-awon niya kung naabay something odd sa kanang ulo, sa skull. Another one is muscles may be inspected for their tone. So, kung soft ba siya or rigid, pwede po siya i-examine or inspect for its strength. Kung weak ba ang muscle, kung kuan ba siya kanang luya, and size, kung i-compare siya sa other muscles. So, for example, sa tanang muscles na to sa to ang lawas, pag naay something odd, naay something na nagburot, then, mo na siya ang physical examination. Mo na siya ang kanang result sa physical examination. Another one is the clinician conducting a neuropsychological examination may test for simple reflexes. So, ginatest niya ang reflex sa isa ka client, sa isa ka patient, no? Another way para sa physical examination. So, ang physical examination kay designed ni siya to assess not only the functioning of the brain, but also aspects of the functioning of the nerves, muscles, and other organs and systems. So, it is also used to shed light on the adequacy and functioning of some of the 12 cranial nerves. So, si cranial nerves, apil ni siya sa atuang neurological functioning. Now, makita ninyo sa inyong next slide ang another table. This is probably table 14-5 entitled Sample Test Used to Evaluate Muscle Coordination. So, naa si walking, running, skipping. So, i-test na siya, ipabuhat na siya sa tuwang pasyente. Pag naay problema ana, then mag-ensure siya og another further investigation for neurological problem. And then, naapod tayo standing still. Technically, the Romberg test. So, patindugon lang nato nga pinaka-still ang kuan kung kaya niya i-balance ang iyang lawas. We also have nose, finger, nose. So, kung kaya ba ma-identify sa to ang pasyente, kung saon katong, basta mag-need ni siya og left and right nga kanang kuan nga hands, tapos ang finger, tapos ang nose. Now, another is the finger wiggle. And then, sa next slide na pud nato is makita nato another table na pud siya, but this is very comprehensive na since mga summary na lang man ni siya and other kanang pinaka-easy nga makuha nato nga kanang mabantayan nato. So, the table 14-6 is sample test used by neurologists to assess the intactness of some of the 12 cranial nerves. As I've mentioned before, katong physical examination kay naga-shed light siya sa functioning sa 12 cranial nerves. So, mao ni siya ang naa sa table 14-5 or -6 if I'm not mistaken. So, sample test used by neurologists to assess the intactness of some of the 12 cranial nerves. So, pag intact ang katong mga 12 cranial nerves, meaning wala tay problema. But then, if naay problem something else, then naga-ensue siya or naga-prompt siya for the idea nga na or for the possibility nga na neurological damage. So, next sa tuwang listahan is the Parkinson's disease. So, si Parkinson's disease is characterized primarily by disorders of movement such as tremors, rigidity, slowness, and problems with balance and coordination. Surely, since na-mention man ako siya ganina, no, nga if there is problem with balance, there is problem with movement in general, so, naga-ensue siya nga na ay problem sa brain, no, sa nervous system. So, ang Parkinson's disease, mo niyang characterization. So, pag na problema sa movement, as mentioned or makita ninyo sa screen, mao na ang kanang characterization sa Parkinson's disease. And the Parkinson's disease is another medical disorder under neuropsychological, right? So, si Parkinson's disease is a progressive neurological illness that may also have several non-motor symptoms associated with it, ranging from depression to dementia. So, kung na-mention ninyo, na-remember niyo ganina katong other table nga akong gipakita previously sa tuang slides, natay katong technical names for kanang mga problema sa neurological or neuropsychological, na dito ang dementia. Problema for dementia or katong technical name for a medical illness nga kanang naga-ensue og depression. So, si Parkinson's disease, kung ang characterization niya kay in terms of movement and other non-motor symptoms, na siya, musulod siya diriya. So, problema jud siya sa neuropsychological or neurological. So, si Parkinson's disease, again, pwede siya mag-characterize sa movement, so sa mga motor symptoms, and or pwede siya nga kanang non-motor symptoms. So, si Parkinson's disease, ang cause niya is, it is a result from cell loss in a specific area of the brain called the substantia nigra. So, pag naay ka ng cell loss sa katong site sa ato ang brain, mag-cause siya og Parkinson's disease. So, it is a consequence of It is a consequence of the compromised function of substantia nigra to produce adequate levels of dopamine. So, pag dili enough ang gina-produce ni substantia nigra nga dopamine, kung dili enough ang gina-produce anak niya nga dopamine, naay result in terms of cell loss. So, pag naay cell loss, again, naay Parkinson's disease. So, other causes of Parkinson's disease, it is essential that we know this kasi dili lang man siya kanang sa tuang brain, but other causes sa Parkinson's disease could be caused by certain prescription medicines and non-prescription street drugs. So, kaning mga prescription sa mga medicines nga kanang naay side effects, especially those non-prescribed nga mga drugs, mag-cause siya sa Parkinson's disease, no? It can also be due to hereditary factors and environmental or environmental factors. So this is the other causes for Parkinson's disease. Another aspect of the Parkinson's disease is its disturbance in motor functioning. Kaganina, I've said before nga ang Parkinson's disease is mag-characterize siya sa primarily sa motor movement and non-motor. So, pag naay symptoms for non-motors and motor movement, then naay Parkinson's disease. Now, pag na-disturbance in motor functioning, ang earliest stage niya pag Parkinson's disease siya, can be slight tremor of a finger. So, tremor lang siya sa tuwang finger. But then, pag mag-progress na siya, nakakadugayan buong hands na nato, and then buong arms na. But then, pag mag-progress na siya to its last stage, it can worsen and can be experienced on other parts of the body. Dili lang siya for example, right hand nimo imuhang pinky finger na ay tremor. Tapos kadugayan all fingers na nimo sa imong right hand. Kadugayan buong hand na nimo, tapos buong arm na pud nimo. Tapos, pag mag-progress na dyan siya, mag-worse na dyan siya, you can, an individual with Parkinson's disease can experience tremor on other parts of their body. Now, other disturbance aside sa katong tremor is disturbance in stiffness or rigidity of the muscles. So, again, kung inyong na-remember sa characterization sa Parkinson's disease is ginatanaw niya kung naay katong sa stiffness or rigidity sa muscle. So, mo ni siya ang disturbance. Further explain lang siya So, pag naay stiffness or rigidity sa muscles, naay movements nga slower, like dili na siya kasing abti, kasing paspas sa una. Na ay difficulties with gait and balance, na ay difficulty with fine motor task, and na ay issues with swallowing or salivation. So, mao na siya ang other disturbances nga makita sa pasyente na ay Parkinson's disease. Another is the non-neuromuscular symptoms. As I've said before, ang Parkinson's disease is pwede siya mag-characterize sa motor, kung asa makita katong movements ato ang pasyente, but also it could also be kanang symptoms for non-neuromuscular. So wala naga-involve og muscle. So this includes sweating, fatigue and sleepiness. So maglisod og tulog, kay very anxious, very fatigue, ana gani. Tapos naay problem for cognitive task, or naay problema for urinary, sexual, or gastrointestinal. So, pag na siya problema, pag mo ni siya ang mga symptoms sa isa ka pasyente nga naay Parkinson's disease, it is termed as non-neuromuscular. Now, kung i-explain naman nato i-introduce naman nato ang katong mga symptoms sa Parkinson's disease, iyang characterization. Now we will talk about the Parkinson's disease interventions for early stages. So ang isa ka pasyente pag napalang siya sa early stages sa iyang life or sa iyang life in which na-diagnose siya with Parkinson's disease, it is important that we employ, manifest, and apply good nutrition. Another is exercise programs, counseling, adjustment in medication. So, si good nutrition, it is important that we make sure that our patient is healthy. Nagakaon siya og tama sa oras, tama nga appropriate meal, and of course the exercise program, since naman siya problema or characterization nga ang Parkinson's disease is na characterization sa problema with motor skills. So it is important that ang ma-employ sa exercise programs ang iyahang balance, iyang coordinations with his or her movements, and then the counseling is because patients with Parkinson's disease is very, very vulnerable to depression, since again, fatigue man sila, ana gani. So, it is important that an intervention such as counseling is employed. Now, adjustment in medications is here for early stages is that because sometimes PD cannot manifest, no, kanang dili siya mag-manifest daily. So ang adjustment kay ginabuhat siya in terms sa severity sa iyahang symptoms. Now, adjustment in medications can also be an intervention for kanang for patient with Parkinson's disease pag kani sila mag-progress ang ilahang disease, ang kaning Parkinson's disease. Now, pag nasa later stages ang PD, other stages may not be as effective as they once were. So, katong good nutrition, katong exercise program, katong counseling, probably dili na to mag-work sa to ang patient na ay PD. So, reason why is again, ang katong counseling, dili na to siya possible is that because depression can be very difficult to manage na. If ever man ma-manage siya, magsigig balik-balik, magsigig reoccur, magsige og kanang magsige siya reoccur, no? So, mao na siyang difficult siya to manage. Now, specifically, ang interventions for PD's late stages is invasive intervention. So, sa invasive interventions, natay deep brain stimulation. So, it is a neurosurgical treatment for use with patients who have advanced PD. So, neurosurgical treatment. So, kung kaganina, ang katong physical examination, diba, mga non-invasive man to, dariyan na pag ma-diagnose na ang patient with PD, with Parkinson's disease, and then na siya sa late stages niya, there is a need for invasive interventions such as deep brain stimulation. So, ang medication sa PD kasi nato is ang medication nato sa PD is it is not to cure PD. Dili siya para mawala ang PD or ang Parkinson's disease isa ka pasyente, but only to alleviate troubling symptoms. So, katong let's say for example kung problema niya sa coordination. So, kung dili to ma-alleviate nga problema, edi na siya problema sa iyong functioning sa iyong daily life. Kung katong tremor, dili na siya makagamit og kutsara, dili na siya makagamit og pen. So, ang medication for PD is used only to alleviate symptoms of PD. But then again, kato siya only applicable lang kapag wala pa wala pa nag-progress ang symptoms, ang kanang symptoms sa PD. So, wala pa siya sa later stages niya, sa pinaka-last ka stage. Now, to date, no medication can cure PD. Again, wala pa gihapoy medication nga makaingon nga maka-cure jud sa PD nga. All patients who were diagnosed with PD stays diagnosed with PD, and many medications have their own different baggage. So, unsa man yung mga different baggage ni medication for PD? Mao ni siya ang katong mga side effects. There are many side effects for medications nga ginagamit sa PD. Mainly it is with dopamine, mga inana nga mga baggage.